हेलो, मैं हूं स्मिता कुमार और आप देख रहे हैं मेडी सर्कल। आज हमारे हेल्थ केयर स्टार्टअप सीरीज में वी हैव संजीव कुमार जैन with us. An architect by profession, Sanjeev Jain is an entrepreneur in the field of eldercare, healthcare, and design with construction. In 2016, he launched a social venture named NEMA Eldercare in Gurgaon. And NEMA Eldercare aims to provide the elderly's mental health and quality of life. So let's find it out what more NEMA Eldercare is doing and how Sanjeev Jain is building this up. Hi Sanjeev, welcome to Medicircle.
Hi, hi.
So
Really nice being here.
same here, Sanjeev. So profession से आप एक architect है, तो architect होने के नाते आपको elder care में अपनी entrepreneurial journey जो आपने शुरुआत की उसके लिए आपको किसने inspire किया and from where did you got the inspiration?
It's a very interesting story. I was head of development of IREO developers, looking after their Punjab division. So we had 1,200 acres under our design and construction.
Okay.
And I was the person who used to think of the products to be launched and design them and launch it along with the pricing. So we had 19 acres of land lying in institutional belt in Mohali, and we didn't know what to do with this. So I came up with the idea. I was searching for the products. I saw the senior care product and I thought, let me launch it because that didn't exist in North. So I tried to launch it for IREO. Unfortunately, for lack of any government policy, we failed. Now, but however, that thing stuck with me. In 14, I left IREO. And that whole idea was there in my mind. And I thought, let me do it in any way. So I started thinking and I had a small plot. I started construction there in 14. It took me 2-3 years to construct it. I studied the whole model and finally it took me 4 years to launch. 16, I formed the company. In 2019 only, we became operational. So I'm a slow guy, but since 2010, I'm putting in the effort. It took me 9 years to launch this NEMA Eldercare.
Okay, that's good. And what problem exactly is NEMA Eldercare planning to solve?
See, we realized that mental health is a big challenge that is not being addressed. So total, if you look at the elders, around 10% of elderly are going to face dementia, Parkinson's, or all these things. So there was hardly any centers, hardly any education there. So we thought, let me address this problem. And there were some issues that families also, we saw our seniors suffering through them. And even the educated people do not know that, their parents are suffering through dementia and all. They treat them as, okay, this is an old age illness, and they just leave it like that. And their quality of life really deteriorates in their homes. So we realized this problem, and I'm trying to address that problem only through NEMA Eldercare currently.
Okay. And there are other similar providers also, like you have competitors like Imoha Eldercare, Ashiana, and other ventures that provide similar kind of services. So what is the unique value proposition that NEMA Eldercare is having over its competitors?
Sure. See, you're very right. These are the big players and with deep pockets, I must say. So Imoha is broadly into home care, okay, and they address all kind of problems. So they provide home services, and they are doing some technology work also. Through this, they try to take care of elders at home, but they are not focused on dementia. Other partner, as you say, Ashiana is their model is mainly real estate. Their money lies in real estate. They are developers, and this is just a add-on thing. Once they say, okay, from using senior care, they try to sell their products. The idea is to make money selling the product. Now, while us, like, we don't make our money through any product sale. We don't send really people any kind of service like that at home. So we are very much focused on mental health, and we also have a home care division, but our focus still remains uh, that we serve people who are suffering from dementia. We train these caregivers, whether these caregivers are their family members or we take staff, we train them at our center, and then we send them to their homes to serve these elderly, because serving a dementia patient or serving a dementia elderly needs very different kind of training. Okay, so it is not just activities of daily living. You have to address his mental issues. So we train people, and we like our whole focus is mental health. While Imoha and Ashiana, no, they are not my competitors, no way.
Okay. And as for holistic care, you have partnered with a lot of healthcare providers and also especially healthcare professionals like team of doctors. So how many doctors you
Yes.
have already onboarded to provide the best to your customers?
Like if you look at our website, we have more than 25 doctors on our panel,
Okay.
and they involve all specialties. So, the minute we have seniors at home uh, or at our care home, they are suffering through various issues. Now, they really cannot connect with these doctors, and they find it very difficult. So we have a team of nurses, physiotherapists, care attendants
Okay.
who link doctors with uh, these patients. And now we have gone one step forward, where we have launched doctors at home. So we have around 15 doctors with us who will reach out to the elderly at their home. And while on video, they will be connecting with these specialists, and we will be able to take care of them at home. So this is the next level that we are trying to reach.
Okay. And to date, how many elderly lives has NEMA positively impacted?
See, we currently are serving 16 elders at our care home, and more than 30 elderlies at their home.
Okay.
So totally, like we are serving currently around 45 elderlies, but
Elderly.
all are suffering from this mental health issues only. We
Okay.
remain very focused.
Okay. And does NEMA plan to expand its presence beyond Gurgaon in 2022?
Oh yes. So we are taking two steps in this direction. One, we are the first elderly service that is being launched in a franchising model. We have signed up with Franchise India, and we hope to launch soon, I believe, in another 1 month or 2 months. Second, we have tied up with JLL, and we are trying to enter the senior care sector through as an operator.
Okay.
Okay. And so these are the two areas. And then doctors at home. And another last thing we are doing is we are launching a startup where we saw the problem of ambulances. So we are aggregating ambulances across India, and we'll soon have a platform for this, just like Ola.
Okay, that's good. So, like, as your venture has been progressing, especially in dementia and elderly care, is it still bootstrapped, or you have received any funding?
Bootstrapped. But
Okay,
yes, I think we are now moving towards funding, and we have appointed consultants, and we are there in the market.
that's good. So, and
Up for
like,
sale.
so what is the response of the investors? Because see, again, they.
No, we have not yet approached any investor. We have
Okay,
just started the process.
okay, okay. And what were your revenues in FY21, and what are you planning to close at the end of FY 2022?
22, I hope to reach 2 CR
Okay,
enough for care home. And 21, we were in the range of, I think, 1.2 CR or something like that. I don't remember exactly.
okay.
So it has been just 2.5 years. And all through, we have been kicked hard by COVID.
Yes.
But still, I think we have survived, and we are doing well.
But I must say that COVID might have helped you out also because it has accelerated. There were so many senior citizens who were locked up into their homes and they wanted access to better care, better services. So, how has the COVID impacted your
You're
services?
Yeah, you're absolutely right. They realize the problem, but affordability always remains an issue.
Okay.
So most of our residents, their children are abroad, either US or UK, Australia. Now, because of closure of air flights, they could not come home. Okay, so they wanted to shift to our care home, but they could not do it because they were blocked. So yes, it impacted us badly, and cost of operation went up at least 50 times, like 50%.
Okay.
Okay, and once we committed to our clients, then we were just charging the same thing. Uh, so yes, we were bleeding.
Okay. Okay. And what are your future goals? I mean, what are your plans for the future that you want to achieve in the year 2022?
Yeah, yeah. So target number one, we want to become the biggest assisted living care provider in India. And I can challenge anyone, any caregiver, whether big or small, that there will be no care home better than us
Okay.
in terms of dementia care. Open challenge, I must say. We look at our activities, look at our care that we provide, and we are value for money providers. So we want to spread across India on 3-star, 4-star model. We are not going to lower level 2-star, what you say, or 5-star. So we are for upper middle class, and that's target number one. Target number two is I want to work as operator in senior care sector, because this is the toughest area that in elder care. Once we have done this, I think others should be cakewalk for us. Yes, there's larger volume, but that should be easy. So for that only, we have tied up with JLL for all the four sectors. I think we have signed up for Delhi, Mumbai, Goa, Hyderabad.
Okay.
So let's see how it progresses. We remain hopeful, and I hope we just expect that the funding happens in another 2-3 months, so
Yeah.
that all the plans that we have, it needs some bit of money. We don't need too much money, nor I will go. But we are not in a cash burn model like lot many other players. We are value for money, and we are breaking even. I think most of other care homes are making losses. We are breaking even.
Okay. That's good. So thank you so
So
much.
we are very tight.
Yeah. So thank you so much, Sanjeev Jain, for coming to Medicircle and sharing your insights on mostly how elder care is being given in India, because there are a lot of providers, but definitely NEMA elder care is concentrating only on dementia and also a specific class in the society, and trying to give a better service to all those elderlies who want value for money solutions for them. All the best for your future endeavors, and also hope you get funding soon. Thank you so much for joining.
Thank you. Thank you. Very nice talking to you.